Good evening and welcome to Sweet Beginnings. Thank you for joining us tonight. Let's begin with the beginnings are so much sweeter when they are long awaited and anticipated, like our addiction treatment center in Cambridge. What began 4 years ago as a dream of a more dignified place our loved ones could go to for help became a journey of unexpected twists and turns. From adding another floor midway due to the growing need, to an online petition, to a devastating fire, and then a pandemic, with your encouragement and support, we stayed committed to building this new treatment center that will now serve our region and loved ones for decades to come. With great anticipation and excitement, at last we moved in on August 24th. This was indeed a sweet beginning this year. In our food area, COVID required we find new ways to share food. In the first 25 weeks of COVID, we shared 500,000 pounds of food in places like parking lots to keep everyone safe. We met folks online with cooking and social programs to keep them connected. Hundreds of phone calls were made so that people knew that they could still get food. We added food delivery for those who couldn't get out to ensure no one was left behind. Now that the back to school season has started and we continue to support families with things like healthy snacks, connecting with youth and parents, and stepping into gaps that COVID has created in the supports available to these families. The same pivoting has happened in services in our neighborhood services, where we continue to support families living on low income. We just had to do it virtually now. The team embraced new ways of doing things, like running a successful youth cooking program that helped these youth connect with their parents and learn new skills together, and embracing all sorts of new messaging platforms so that our family outreach workers could continue to communicate and support these families during this time. And lastly, in housing, at this time in the sweet beginning, it's probably the one you've heard the most about, and that's shelter care. So here tonight, I'm honored to have Jess Bondi here, our housing director, who leads the housing team, the shelter team, and has been a key instrumental part of this shelter care piece that we've worked on. Take us back to March, when this all started.
So, take a moment, reflect on March. We realized that we had to panic productively. So that's exactly what we did. We had 2 individuals in our shelter who were struggling with symptoms of COVID-19. And very quickly, we realized that we had to solve that problem. John and I were on a call, and very quickly an email came through from our friends at the Radisson Hotel saying, how can we help? And within 24 hours, we had redirected city buses. We had taken our 51 men from our shelter, and we had transitioned them all the way to our new location at the Radisson Hotel. Now, the Radisson was incredible because it gave us the chance to support our shelter participants 24/7. They could create their own schedule and create their own routine. We were able to very quickly reutilize resources within the system and in the community and bring them right on site. So our participants had access to housing whenever they wanted. They had access to connect with our primary care clinic and get, a prescription sorted for them, or connect about maybe their blood pressure. They had the opportunity to get naloxone right on site as well. Those are some of the things that we've realized as a result of moving to this new way of doing things, is that we provided people, our participants, the chance to choose. And then the other big piece that's been so successful is the relationships. We engage in this work by connecting, by supporting people. And those 3 things, along with the healthcare, has been so essential in making the shelter care dream come to life.
I think the key point to remember here is that we didn't just move into a hotel, is that we integrated with healthcare and all these necessary other services for this population. That is absolutely critical. What have we learned from the last 7 months?
And there's some big numbers. A 75% decrease in the number of our participants who are making their way to emerge. That is incredible. 0 people in our shelter system have experienced COVID-19. We've housed 56 men in our community as a result of COVID-19 and the shelter care model. And to me, that's incredible. One of the results I wanted to share is also our police stats. So what we've noticed, as you can see here, that we're relying less on our police services. So the bars that you'll see here in blue are at our old shelter. So you'll see those lines, to the far right, and that's how often we had police on site. And the orange line that you see is the new shelter at the Radisson location. And a point I want to make is that at the Radisson, we also doubled the number of people we served. So there are 100 people that we're serving, and we're seeing this decrease in police services stats. That is incredible. It's absolutely remarkable. So our shelter staff, they are the champions for our participants. They care so much, and they pick our participants up when they're down. But what we've been able to see through this model is that our shelter participants have hope, that they are excited about their future, and that they realize that they can do it. That is life-changing. The fact that through this model, we've been able to ease up a little bit for those participants, that we've been able to create that mind shift and help them believe that the future is bright and that good things are going to come to them. That is absolutely incredible. And I think it's that attitude and those changes that we've been able to do that really do make it so that once we house people, they stay housed. Of the 56, not a single one have come back to the shelter system. We've set people up for success. We know that housing is how we move the needle on homelessness in our community, and the shelter care model has been so successful in doing that.
Housing is the answer to homelessness, absolutely. And shelter care, when done properly, can be like that triage, can be like that place where as soon as someone comes into homelessness, we can do an assessment, we can address their physical health, their mental health, their addictions. And I feel like that's what shelter care is able to do for individuals. And so I'm not surprised that the numbers at this time is still zero of people who've returned, with unsuccessful housing. So I'm really excited about that and seeing this as a potentially really great way to make housing first in our community move forward in a more effective and an efficient way.
What we're continuing to see is that as more and more people and organizations hear about this great work, there are so many more partners who are coming to the table, and that is ultimately benefiting, our participants and the folks that we serve. Every single one of our shelter workers are now trained in engaging in housing plan conversations, and that's another way we've leveled up. Right? We want to make sure that we are continuing to engage and promote housing. That is really what we are looking to do in this model. Some of the other things when we think about the future of shelter care and where we're going, there are so many other shelters across the country and across the province who are curious about this model. And we've been able to connect with them. We've been able to share some of the early successes and our wins, provide some, tips, recommendations, whatever it might be. But it's still early days. We feel like we've got something here. This is a model that is working in our community. It is a dignified shelter environment, and it's creating incredible outcomes, not just for our systems and the other systems that we touch, but for our participants. And so, we ought to continue to bring shelter care to life in any way we can and in a variety of different communities, because it is truly making a big impact.
There's no going back, Jess.
Yeah.
What I've loved about the shelter care model is I've watched our community come together and do this model together. Is what I love about it, it's not rocket science. It's just simply integrating shelter and healthcare and other related services. It's a simple concept. It's one that can be done anywhere across this province, across this country, and that's, I think, what we genuinely want to see. We want to see a new way for individuals experiencing homelessness, a new way to experience better health and better outcomes for themselves. As we try to move systems and work with our partners at the region and others, let's talk about the individuals, our community partners who've been on the ground, who are there in the hotel every day, our shelter workers who are there on the ground with the individuals. How are they feeling about all this?
Yeah, our shelter team and our partners, I don't have enough words to say my gratitude and my appreciation and my thanks for them. You know, these folks in these pictures, they're heroes on the front line. They're folks that just jumped in to a new way of doing things, to problem solving every single day, believing that this could work and would work. And it's been absolutely incredible to get to work alongside so many people to bring this dream to life. You know, one of the things that really inspires the folks who are making this come to life is you, our community. You know, it's folks like you who are rallying around them. I think for far too long, folks who worked in this field didn't feel like they were heard. They felt left behind or forgotten. And you know, what we've heard through this national conversation and the coverage that we're getting around this model is that, you know, Waterloo Region has our back. You know, that they aren't out there alone, that they are supported and being cheered on from the sidelines.
So as we end tonight, I hope this conversation doesn't end here, that you continue to ask questions about how we address homelessness here in Waterloo Region, and maybe as a province and maybe as a nation, that this conversation continues from here, and we've given you some things to talk about. Have a great night. Thank you again.
Thanks.